These lovely people here have been holed up in this room intensely debating and discussing the future of the National Health Service, and they've done us proud actually over the last 24 hours or so. What I'd really like to focus on is whether we can have some innovation in the political process, because we're all busy sort of trying to think the unthinkable, and I'd like to invite you three to try to do the same.
I think health is not like other things, at least not in this country. I think whether we like it or not, the concept of the NHS has got hold of people in an astonishing way. It's become very precious. So one of the things we're up against all the time is, why should we make changes? We like what we have. We know there have to be changes, but a lot of the public just wants to say, no, we don't want any change, let's stay with what we've got.
The reason the toxic debate got so much noise is the public didn't know why this was happening. Right? So there's this enormous space. And the interesting thing about it, the particular way in April last year, that in the end suddenly there was a 60% population believed there was a secret plan to privatise the NHS, is because there must be a secret plan because no one's explaining this plan.
That there has to be clarity about why there's a need for change. Partly it's economic, as we know, but partly it's value quality driven. If people experience change as the withdrawal of service, of course they're not in favour of it. If they experience change as we're engaged in an improvement programme, because if we do this it will be better, then at least you've got the debate.
Any politician who wants to modernise or change the NHS has to begin by saying that he or she believes in it. Now that doesn't mean no competition of any kind, but it certainly means that the word privatisation is absolutely toxic. And I think one of the difficulties about the whole debate we've had is that because that word was out there, immediately the debate became about, are you for or against competition? And that was completely the wrong debate.
Incremental change, identifying a problem, solving it, understanding that there'll still be plenty more to do next year, and dealing with the issues as they reach the highest level of priority. I'd much prefer that.
I mean, if you look at what the patient groups have been saying for the last couple of years, you know we've probably got enough money, it's just being spent really badly.
That's right.
So you've got, amongst really significant organisations, a groundswell of not saying everything's great, but of actually saying we need these changes. Now, if we all can't turn that into something for a year before the next election, we should give up.
Even when there's very good information about the quality of care will suffer if lots of small hospitals stay open. How do you change that process that we're seeing?
There's a belief in some parts of the system that you can create some magical management solution where cogs will whir silently and this will all appear miraculously without anybody having to make any decisions. It isn't like that. This is a structure of care that we've inherited that needs to be changed.
Our responsibility is to hand the local and national politicians a public debate rather than hand them an enraged public against it.
Yes, that's
right?
good
And
point.
that's, I mean, the NHS has been really good at doing the second and then saying to the politicians, you lack the courage, when there's thousands of people outside saying you're closing my hospital.
It's the tremendous force of democracy. And you sit in your surgery and I've had this in my own 2 constituencies, and weekend after weekend a delegation appears to say, don't let them shut the ex-hospital.
Actually, what we tend to do is solidify the public against the thing and then blame the politicians. We have got the skills and we believe in these changes, but somehow we don't communicate them so that the politicians at least have a debate to deal with.
If we're going to deliver the kind of integrated services we talk about, that means, in plain English, transferring significant amounts of resource out of the acute sector in order to be able to develop community services. That means reducing the capacity of the acute sector.
As a NHS, we are very good in diabetes services at cutting off people's feet and lousy at commissioning walking the dog.
Brilliant, exactly.
And until we get as good as that, then actually people, so actually these are the things that if it's not part of our vision, we're failing.
How you encourage people to think about their contribution to the social care element of repackaged care is an important part of that question. But if it's seen in isolation, from the issue of reshaping the way care is delivered, you make the task much more difficult for yourself than it needs to be.
We really ought to think in terms of should we actually be combining at the local level social care and health by actually having a single administrative system. Now that's pushing both sides further than they want to go.
One simple budget that is allowed to look across these different silos, if you allowed people to do that, you reverse a whole series of perverse incentives that exist in the system.
Our responsibility is, as has happened in health, is to actually rework civil society so it's making slightly different demands for change and not for stasis.
Thank you very much. Thank you very much for your frankness and full answers to those questions. And please everyone join with me in saying thank you.